I'm very excited to say that we have Dr. Anita Federici with us here today, and she's going to be talking to us about stress in the workplace, an issue that I think has been present for a lot of people for quite some time, and something that has probably been exacerbated by the pandemic. So thank you, Anita, for being here today. And a big thank you to LeClaire Cremation Center, because they are our sponsors for this session. We've had a number of sponsors throughout the week to provide these sessions, so they've all been free. We do have a link in the chat to the COVID-19 Mental Health Relief Fund, and all proceeds will go to supporting people during the pandemic who have been struggling with mental health issues and help improve care in the region. And my apologies for the sounds in the background. We also have Midland Honda and Brissett Concrete and Forming, who have been our week-long sponsors. So I'm going to turn it over to Anita before my daughter is any louder.
Actually, so thank you, Holly, and thank you to everyone for inviting me to be part of this. I think this is such an important initiative in our community, and it's my honor and pleasure to be speaking with you today. And I actually think, Holly, it's sort of a timely experience to watch you at home with your young daughter, because I think it's part of the reality, and it's part of what I'm going to talk to you guys about today is how our workplace has changed given COVID, and what people are experiencing, and how we can cope. What does psychology say about how we can cope with what's going on? So without further ado, I am going to share my slides. Those of you that know my presentation style, I'm pretty interactive, which is, if you've got questions while I'm going, unmute yourself, talk to me, put it in the chat box. I'd rather have a good discussion with people about the things I'm presenting, if you're willing. And if not, I'm happy to just chat away for the hour. So I will sort of take your lead as we go. And feel free, I love seeing people's faces. I understand you might be eating lunch, but it's so lovely to see you if you can. Okay, so I've been asked to do a lot of work with different organizations, different groups over the last 6 to 8 months, particularly about topics like this. So I'm going to share with you today some of the, to me, the key strategies, key insights that I am sharing with other people. And frankly, these are the things that I'm using and I'm using in my clinic. All right. So most of you are probably aware of Maslow's hierarchy of needs. Let's reacquaint ourselves for just a moment, because I think what COVID has done has shaken the foundation of what this actually is. So Maslow said, his theory was, we're healthy when these needs are met. We do well, we thrive under certain conditions. And some things are more foundational than others, in the sense that if your physiological or safety needs are not met, it's really hard to build relationships and have good self-esteem and have meaning in your life. So he posited that at the very, very fundamental level, and I ask you to think about your own life over the last 6-7 months. We need to be able to meet our very basic physiological needs. Sleep, eating, is there food on the table? Do we have shelter over our heads? For some people, the pandemic has absolutely interrupted some of those things. And it's very hard to have healthy workplace environments when this is going on for you or for your staff. Think about safety needs. This is not only physical safety, but psychological safety. And something that happens with a pandemic is that everything that you thought you understood about the way the world works, at least here in North America, was turned on its head. I don't think any one of us could have predicted or anticipated what our lives look like right now. And what I'm seeing a lot on social media is people showing pictures like, look at, this was us last year at Thanksgiving, full of family, full of busyness, full of outings, and how different everything is. So our very sense of safety and security and predictability has been removed in some cases, has been shifted. Safety also refers to financial safety, job security. And we all know that many businesses, many work environments, if not all, have been affected by COVID. Some people are out of work. Some people are on leave because they're immunocompromised and can't go back to work. So we start to see how when we're thinking about health in the workplace, you have to think about what's actually going on for people. And these two core chunks of how we are healthy have been largely, like I said, shifted and disrupted over the last 8 months. And then as you move up the hierarchy, love and belonging. What is love and belonging in the age of social distancing? The degree of social isolation, loneliness has been, astronomical. As a psychologist, it's one of the things that I'm working with so many people on, is a feeling of disconnection. Even on my own team, yes, we do this, we Zoom together, we see each other. It's not the same as sitting in a room together, freely, having lunch, talking, bumping into each other in the hallways. We miss each other. And I think a lot of people are missing the normative interactions of belonging and social dynamics. Hugging, seeing a friend and going, oh my God, it's so good to see you. Wow, that's gone. All those little nuances that we would have done at work, the way that we engage with people has all changed, or comes with a lot of, we're wearing masks, we have to hand sanitize. This fundamentally changes our sense of relation to other people. And then, of course, we need self-esteem. We need to feel respected and valued and needed. And you've seen, I think of the small business owners who are, whose jobs are at risk, the restaurant businesses, all of us trying to make our living. People's sense of meaning and worth and true self-actualization has been disrupted. Okay, so when I was thinking about this talk, I thought, this to me makes a lot of sense, because this is what we actually need in our lives. And the pandemic has really changed all of that. These are just some examples. So I sort of thought, okay, so our foundation has really been shaken. It's like an earthquake has kind of moved through our lives, right? And there have been major changes in the workforce. And maybe if you don't feel like telling me or chat me about what the changes have been in your life, but there's this massive shift to working from home. And while there are some people that actually works better for most of us, it's difficult. It's difficult to organize yourself at home. Not everybody feels as motivated. It's distracting. I have a young daughter. I homeschool. It's really not the same. It's very, very overwhelming at times. And so that's a big shift that has psychological impacts on us. Women are foregoing their careers to stay home at much, much greater numbers than our male counterparts. There was just another article that came out last night about this, and it's really, it's really fascinating to watch what's happening. The rates are about a third of women in Canada are actually considering quitting their jobs in order to stay home to support the family. And participation in the labor force for women has reached its lowest levels in decades. This has major implications for our workforce, but also for the mental health specifically of women. I'm looking at some of the chats. I am single and am now working completely alone. Teresa, I think that is the reality for so many people. I have a number of colleagues, clients who are really suffering because, yes, they're still able to work and they're alone at home all day long. And I know for me, because I do this too, I'm at home, you know, I don't see a lot of people. And even though I'm social all day on Zoom, it is not the same. Sometimes my neighbor and I will just do a quick hello over the fence, and I'm shocked at how different that feels to like have a live person. Yeah, some head nods, right? Catherine, I went from mat leave to a combination of work from home and redeployment to the assessment center. It's been quite a change. One of the biggest, Catherine, you know, thanks for pointing that out, because the deployment, first of all, the deployment in our hospitals and in other areas has been massive. I have people and friends who have been pulled into jobs they're not trained to do to try to help with the pandemic, and the stress and the exacerbation of depression, anxiety disorders, eating disorders. You know, those of you that know me, I specialize in the treatment of eating disorders, among other things. We've seen a massive increase in eating disorder symptoms recurring during the pandemic because the stress is so high. I have had clients who actually, they've been redeployed and are working like 10, 12 hours a day, and they don't have enough time to eat, which then triggers their eating disorder stuff. So it's interesting. It's interesting. So thank you guys for letting me know. And then, right, and this combination of I'm partly working from home, I'm partly at my office. It's stressful. Our routines are they even routines? I don't even know anymore. I'm not sure. Business owners are in crisis. So quite apart from what's happening in our hospital and our healthcare system, you know, the full and partial lockdowns, the sense of unpredictability, the sense of, you know, I watch the restaurant business and I think, you know, with more lockdowns, I can't imagine the stress. You know, am I going to make enough money? Am I going to be like, so you remember, think that hierarchy of needs, right? And just the social distancing requirements. Many businesses can't function in the same way. And so it's really been so stressful. And as someone that also works with suicide and self-harm, you know, we're seeing rates of these things increasing because people are losing hope and losing their sense of stability. And that's very concerning. So the financial uncertainty is big. And even the return to work, you know, just even watching the teachers, I have so much respect for our teachers getting out there and and having to figure this all out. And the level of stress and anxiety that people are facing, even when they're continuing to work, right, is massive. And you know, and I give Waypoint so much credit for taking time to do these sorts of initiatives, because we need to talk about these things. And so that's what I want to get to. Let me just click here. Because what I want to highlight is that COVID as a worldwide event actually changes your body chemistry. And it does so because COVID is perceived as a threat. It's a threat to our safety and sense of security and our predictability. As humans, we like to feel in control. Anybody else? I know for me, I like to feel like I know what's coming, right? So by virtue of what has happened to us, our fight, flight, freeze system, which is our sympathetic nervous system, it's on overdrive. Maybe you've noticed this in yourself. I have, right? People are more anxious, more angry, more irritable. We're not coping as well. We feel burnt out. We feel overwhelmed. That's because our brain says you're under threat. You're on high alert. And what that means is we're not sleeping well. We're not eating well, right? Because the brain is interpreting this in a particular way. So let's look at what happens to us when we are under threat and when we start to get emotionally, I call dysregulated, right? Anybody get triggered today? Anybody have anything go on today? Yeah, and triggers could be your computer didn't work. It could be the coffee maker broke. It could be, it could be that you were late for something. It could be, I don't know if people are chatting up there and telling me anything, but what triggered you today? And did you feel an emotion? Anybody? You want to tell me? Maybe you don't, that's okay.
Well, I'll chime in. It was a little out of the plan for my daughter to come home from daycare in the middle of the day today during this. So it was fine. And I've got a lot of support, which is great. But yeah, for today, it definitely put a bit of a wrench in the plan.
And Holly, if I could just keep you on for a second. So there's the trigger, right? I get called from whatever daycare. I need to pick up my daughter. What's the emotion do you feel an emotion when that sort of was happening?
Oh yeah, like I think definitely there's a bit of anxiety around, okay, wait, I have things that I cannot postpone today that I need to be focused on, and I can't do that. And then although you assume it's probably teething and that's why she's got a fever, you're also thinking, well, now do I have to get her tested? Does she have COVID? Do we have to change all of our plans? Do I need to avoid the office for a bit? So yeah, there's definitely a degree of anxiety in that.
A lot, right? And I actually think that what you're describing is really normative. This is what's happening for a lot of people. So this part, the getting triggered and feeling emotional or emotionally sort of dysregulated, it's actually normal. It's actually normal, right? So when people come to see me, they're like, okay, Anita, I don't want to feel triggered, or I don't want to get emotionally upset. And I'm like, okay, I can't do that. Life is triggering. Life is going to be triggering, and you're going to feel emotion, and you're going to get dysregulated. That's part of being a human being. The important part here is, what are you doing to actually regulate your emotion? This has everything to do with workplace health, because what's happening is people are stressed and they're putting things in this third box sometimes that aren't so helpful, right? So Holly, what did you do? Like, here you are, you're sitting here with us, you've managed to figure it out. How did you cope with this? How did you cope with all the anxiety you felt this morning?
I'm very lucky that I do have a really great team that backs me up. So the things that I can't physically leave to do today, they were able to cover that. And then I was just hopeful that people would be understanding on the call that, there might be a little bit of crying and I might have a kid on my lap for a second. But, I think people are cutting people a little bit more slack. And instead of worrying about the reaction that people I'm going to just assume that people are going to be kind and give you a bit of a break during this time.
So you notice what Holly's putting in the third box. There's some self-talk, like some positive, like it's okay. She's assuming some good intention. She's not catastrophizing. She's reaching out to her support network. She believes in her capacity to solve this problem. It's not a problem. I mean, whatever, right? Right? And she's continuing to show up. Okay. So one of the things so that's healthier. That's what I would want to see, right? And a lot of people don't necessarily do that because they don't know how to do that. So I'm just looking at some of the chats. Somebody says, having no control is an issue. So a trigger could be, I don't have control. Okay. Something happens at work. I can't control it. My child has to come home and now I can't go to work. I can't, right? All of these things that we can't control. Another person says 100%, I had a morning routine that didn't go off as planned and it was out of my control, right? Another person, the rain was a trigger. I just couldn't stand the gloominess, right? Had my staycation for the next week planned out and a problem arose today and had to cancel 2 days next week. Reached to the chocolate to compensate, right? So this, we are in highly triggering times. Okay, that part, yes. The question becomes, what are you doing? So a lot of the folks, like by the time I talk to people, sometimes they're drinking a bit more to cope, right? They're having a glass of wine every night. They're having a couple of beers every night, right? Because it's just taken the edge off. Some people aren't setting boundaries. They're not saying no when they're being, some people are overwhelmed at work and your manager keeps asking you to do more things and we're having trouble saying no. Poor eating habits, right? So some people are under eating as a way of coping, and some people are emotionally eating as a way of coping, right? I had one gentleman that was really anxious and it was interfering with his work. And I found out that one of the ways that he was coping with his anxiety was by excessively checking the news. So he wanted to know, and he actually downloaded an app that would actually track the death counts at one point. And I said to him, let's look at this behavior. Is this really helpful? So the hard part is that a lot of this stuff, you do get some temporary relief. When he would check the news, it somehow gave him some sense of control. I know what's happening. When you emotionally eat, there is this kickback of, I'm soothed right now, even if it's just for a few seconds. When you don't set boundaries or address things, sometimes avoidance is it feels really good. Good, I don't have to deal with this right now. Just like drinking. When people drink, it takes the edge off. The problem is that in the long term, it doesn't help you get out of this cycle, right? So you end up kind of like on this hamster wheel, okay? And it happens to all of us. So one of the things that I ask people to do when it comes to their health, and especially their health in the workplace, and by workplace, can I please also be clear that I also mean parents that are staying at home and raising kids full time? That's the workplace to me. Okay, as I'm also a single parent, and I get that, right? Like that's work. And I just want to be clear that I'm not just talking about sort of particular types of workplaces. What I want people to do is start to become aware of what they're doing. Okay, so let's unpack this a little bit more. So what do we do? What do we do about all of this stuff? Now, I'm a big mindfulness practitioner because of how effective it is. Mindfulness to me is about awareness, right? One of your greatest tools that you have available to you is your awareness, to know yourself, to know, like if I go back here, one of the things I start to work on with people is, tell me what your triggers are. What happens to you at work that triggers you? Then I work with people to say, tell me what you're feeling. A lot of people don't know what they're feeling. Or a lot of my clients will say, I don't know, I feel blah. Or they go, meh, I don't know. And I say, well, that's not an emotion. And so we know that a lot of people have never really been taught how to really label and identify and communicate emotion. Okay. So mindfulness is actually the practice of starting to tune into yourself, tune into what are you feeling? What are you needing? Because we're trained to ignore signs. We're trained to be chronically distracted. We're trained to minimize our mental health. And that actually perpetuates mental health. So I'm going to go through a few signs. This is what I'm seeing in a lot of people. And I wonder if you are feeling any of this stuff. Persistent anxiety, that difficult to control worry, right? That you can't turn off. You can't sleep at night because your brain won't shut off. Or there's tearfulness, crying episodes, depression that has started to sink in, right? A sense that things aren't as enjoyable anymore. I've heard this over and over again where people have said to me, I just don't feel pleasure in things like I used to. I don't feel like there's a lot of meaning to my life anymore. We also see signs like procrastination, where people are just really, procrastination to me is avoidance, or that I'm dreading going into work. I'm dreading facing the day. I'm dreading another day of whatever. These are signs. Apathy, anger, cynicism. I'm seeing so much anger in the world right now, right? To me, those are signs that people are burnt out and overwhelmed and that their threat systems are on. Who's feeling exhausted, right? The poor sleep that we talked about. And again, the rates of alcohol use, drug use, and disordered eating habits on the rise. There's also this subset of people that are experiencing COVID nightmares, right? So this is what's interesting. We see this in trauma responding, where people start to have nightmares about the trauma. When we feel out of control, it usually shows up in our dreams and our nightmares. So what I'm asking people to do with their mindfulness skills is actually pay attention and to make a deliberate choice not to ignore these things. We know that the sooner you do something about these things, the better the outcome. Okay, so let me keep going here. And this is what I've been saying to you, mindfulness is also getting clear on what's actually happening and what triggers you. Many people have a hard time paying attention to what's happening. And we spend a lifetime avoiding ourselves, avoiding the present moment. Many, many people that I work with really have mastered the art of avoiding reality. And one of the things that we teach people, I say, mindfulness, observing yourself, it's like, and this comes out of Marsha Linehan's work, this is not mine, but she will say something like, mindfulness is, observing is like walking through a furniture store. So imagine yourself walking through a furniture store with your eyes open instead of closed. Mindfulness is walking through the furniture store with your eyes open. Living a life of distraction or unmindfulness is the equivalent of walking through that furniture store with your eyes closed, and you keep bumping into things. You keep bumping into furniture and you're like, what the heck's going on? When you decide to pay attention, you now get to see the furniture, the obstacles. You start to see the path, but you can't change anything that you first can't observe. So if we can't get clear on what it is that you're feeling or thinking or doing, we can't change anything. So mindfulness, to me, superpower. Okay, I'm just looking at the chats for a moment. I'm seeing some positive stuff with some supportive employers, which is amazing. Teresa says, it's difficult to stop the immediate reaction to the problem with the negative emotion instead of stop, wait, and take a breath. Man, Teresa, this absolutely. What I'm talking about here is a deliberate practice. This doesn't, our brains, when we're in threat response, when we feel afraid, anxious, depressed, whatever, the brain is doing its job to keep us safe. So it often reverts to very quick and old behavior patterns. That's where mindfulness comes in. Mindfulness allows you to pause. So if I go back, when I practice mindfulness myself, for example, I start to notice the trigger, even if I just label it. Okay, here I am, I'm feeling triggered. Or I say to myself, oh, okay, now I'm feeling anxious and I have an urge to whatever. By practicing awareness, there's a pause. I now get to make a choice. What am I going to do here? What am I going to put in that third box? And it takes time. It takes time. So let me keep us going. And that's just what I'm talking about here. Put words on your experience. Put a label. Research has shown that when you can actually say to yourself, I'm anxious. I'm sad. I have an urge to drink. I have an urge. You can actually start to change the pattern in your brain. So changing how you're coping at work and at home has to do first with being able to observe and then describe or label it. And this has everything to do with what I'm going to talk about in the coming slides. So I just want to check here. I took the 4-week mindfulness class through Waypoint in September. Excellent. The more I'm telling you, when I teach, when I run our DBT groups, which is all about regulating emotion, I am shocked every time. I've been doing this for years. I am shocked at how powerful this even 6 weeks of mindfulness training is on changing people's emotions and behaviors, etc. Keep in mind that practicing mindfulness changes the way your brain functions. It actually changes blood flow. It changes blood flow from going to the emotional center of the brain, and it moves it to the more logical prefrontal cortex. So if you can get into some mindfulness courses, I highly recommend it. In fact, some organizations that I've been working with are implementing mindfulness in the workplace, and that would be a really lovely thing to help everybody through the pandemic. Because here's another interesting thing. The other thing that you can observe, and those of you that have done some cognitive behavior work know this. Notice your thoughts. What's the story that you tell yourself about work, about your value, about what's happening? We have a tendency to get stuck in the negative. Okay, so what this means, if you follow this along, so let's look, and this comes from a TED Talk, but I didn't have time today to show you that it's a 10-minute TED Talk. And so this is you going along in your life. This is like baseline mood, right? You're doing okay. And let's say something really positive happens in your life. You get a promotion at work. Somebody says, you know, oh, you did great. I love that. And you get this blip of happiness, right? Your mood, and you go, oh my God, that feels so good. Thank you. That felt nice. And our emotions kind of raise, right? And then we kind of go on with our day and our mood kind of comes back down to normal, right? But let's say a couple of days later, something not so helpful happens. Let's say you get some negative feedback on a paper you wrote, or a project that you submitted wasn't really approved or accepted in some way, and our mood drops, and we feel sad. We don't like that feeling. It's a bit depressing. It's a bit deflating. Well, what the science tells us is that unlike happiness, where we sort of bounce back to the baseline mood, when something negative happens, we might feel a little bit better, but we actually stay in the negative mood longer, and we don't bounce back up as easily. And what the research tells us is that our brains are wired for the negative. And they're wired for the negative, not to hurt us, ironically, but to protect us. So imagine it's cave person years, and I'm walking in a part of the forest, and by a large rock, a coyote comes out. My brain wants to remember all those details so that I don't end up in the same situation again. So what happens when we learn something negative is that the brain says, that's a threat. Something threatened my sense of safety and well-being. Let's not forget that. So we actually have to work way harder to come back up. The good news is that you can do that. And the more you train your brain to look for the upside, right, the quicker you'll get out of that negative mood. Okay, so it's important to be able to spend some time every day and say, well, what went well today? Because our tendency is to look at what didn't go well. our tendency is to focus on, even with COVID, it's easy to look at like, oh my God, now this is happening, now that's happening. And what I'm asking people to do is, okay, I hear that. There's lots of scary stuff happening. And what went well today in your life? Give me at least 3 things every day that went well, because I've got to help people get their mood back up to baseline. That's going to help you be more effective at work and in other places. I'm just checking the chat here. Excellent, excellent. I think this is Waypoint. That's what I'm understanding. We have just received more funding to now expand, I think, the mindfulness program to a virtual program for youth. It is linked to a research study that will assess the program for youth and the virtual application of the program. How amazing is that? This is one of the programs that they are funding for, and that the COVID-19 Mental Health Relief Fund will support. Can I tell you that this is a game changer, this kind of training for our youth and for everybody. So well done, Waypoint. Okay. And this everybody laughs at me when I say this, and I'm telling you, this is evidence-based stuff. If you're noticing a lot of worry and anxiety about work, and I'm one of those people, I have a hard time turning my brain off at night, and then I don't sleep well, and then it impacts my work the next day. And I don't know if anybody else has that experience. There's a ton of research that shows that you can schedule worry time. So you actually put it into your calendar and you give yourself a half hour or 40 minutes and you let yourself go. You let yourself, oh my God, what if this happens? What if that happens? But when that timer is done, you're done your worry time for that day. And as kind of silly as that might sound, it works. So that when a worry thought comes up later, let's say it's 8 o'clock at night, and now I'm starting to worry, I might have a piece of paper beside my night table, and I might say, okay, I'm worried about this. That's going to go to my worry time tomorrow. And I can actually let it go because I know I've dedicated time to it. And it helps put some boundaries around it. So that's just a thought, just sharing with you some of the tips and tricks that can help you. Whoops. So here's the other thing. And somebody mentioned that they have a really supportive employer, which is what we need. We need our employers to really help with mental health. And a lot of them have just stepped right up. It's beautiful. But one of the things people need to do is to talk to your boss, your manager, your colleagues, if you can. I understand that there are some environments where that doesn't feel so safe. Okay, so I do appreciate the nuances. However, once you understand what's going on for yourself and that you need something to be different, let them know what you need. I can't tell you how many times I've worked with people who feel scared to do that, are afraid of stigma or judgment. And it actually goes really well. And they're so relieved that they actually talk to somebody about it. Many people, not everybody, have extended health benefits. Look into your programs. A lot of health benefits have been topped up to support not just therapy. I'm biased. I think everybody should have a therapist because it's helpful. I have a therapist, thank God, right? But even just go for those massages if you can, right? You know, go see your chiropractor if you can. Take care of your body, take care of your brain, and request accommodations. One of the things that I do as a psychologist is I assess where people are, and I often do help them get the accommodations that they need. So some of the accommodations that I have put in place for people in the last few months have everything to do with either, sometimes it's a short-term leave, sometimes it's different hours of the day to help them accommodate their homeschooling and their other live work and home. Sometimes it's actually helping people get a different office that's less overstimulating. So I have some people that are working in some environments that are still pretty intense. I've had some people, some accommodations are that they can't be deployed. It's not actually good for their mental health. I have some people that have different illnesses like bipolar disorder and where they've been deployed to shift work. And I've said, this person can't do shift work. because it will trigger, it can trigger their, like a bipolar episode, a manic episode, and that's not, we can't do that. There's a lot that we can do to help you. So please consider looking into those things, okay? And then there's just things that you can do to actually downregulate. That's what I call it. So if you're feeling really stressed, depressed, overwhelmed, like you can't settle, there are evidence-based strategies that literally change your body chemistry. And here are some of them. This all sounds pretty simple, and people, sometimes my clients will roll their eyes at me when I go through this with them. And I'm like, okay, this is serious. We have to have this conversation. If you're not taking care of your body, you're going to be more emotionally dysregulated at work and at home. So for example, if you have a physical illness that you're not managing, migraine, diabetes, multiple sclerosis, back pain, you're going to be more emotionally vulnerable. Okay. If your eating is off, so again, as an eating disorder clinician, I always say to people, I can't help you regulate your mood if there's an eating disorder on board. So if there's a lot of binge eating, emotional eating, or restrictive patterns, a lot of this intermittent fasting wreaks havoc on the emotion regulation system. So the irony is that people in some cases are trying to be healthy by restricting food for long periods of time. And what it's doing is it has this kickback effect of making you more emotionally vulnerable. So that's just something to pay attention to. Avoid mood altering drugs. I hate to be the one to tell you. And a lot of my clients, you know, they'll say, Anita, I'm not an alcoholic. It's not like I have a problem. And I say, it's not necessarily that everybody has substance dependence. And you have to keep in mind that when you have a drink of alcohol, when you have, or you're smoking pot, or you're whatever you're doing, a lot of that stays in your system for more than a few hours. So if you had a glass of wine last night, and these things are depressants, some of them are stimulants, depending on what you're doing. Those things are going to make you more vulnerable to being emotional. Sleep is the other thing. I remember working with a psychiatrist years ago in Cleveland, and he used to say to me, I swear, Anita, if I could cure people's sleep problems, I think I would cure half of the mental health problems that go on. And that's always stuck with me. And anybody that's ever had problems with sleep, myself included, you know how much more vulnerable you are when you haven't slept well. And exercise is the same thing. This has been another major impact of COVID, right? So, you know, people are they're not moving as much. I was half laughing and half maybe crying, I think, to my friend the other night, because I said, I think my step count is like 200 a day, because I literally, you know, like I go from my upstairs into my basement office and I sit here all day, like, you know, and then it's like 6 o'clock and I'm exhausted and I sit down and go to bed later. And it's like, wow, that has an impact on your emotion regulation system. Okay, so I'm seeing some head nods and some good, you know, so maybe I'm hitting the right thing. Practice with gratitude journaling. Interestingly as well, Melissa says substance use can interfere with REM or deep sleep. Bang on, Melissa, you got it, right? A lot of times we want to minimize these things that we're doing because we're like, it's just not a big deal. I'm just going to have a glass of wine. It absolutely does interfere with the quality and duration of your sleep and your deep sleep. So, okay, so now that we've talked about those things, the other thing that I teach people to do is self-validation. Okay, so validation is communicating what makes sense about a person's thoughts or emotions or actions. The problem is that most of us are we've built a life spending all kinds of time criticizing ourselves, shaming ourselves, and blaming ourselves. So what we do is we invalidate ourselves. And this is happening all over the workplace. So a lot of people are saying to me, I can't do this. I'm not, I'm not coping well. I'm failing at work. I'm not doing a good enough job. I'm failing as a parent. I can't homeschool my kids. Whoa. What's actually happening from a biology level is this. When there's invalidation, when you judge and criticize yourself, you actually activate your threat system. There's all kinds of research. I wish I had more time to go through it with you, but there's all kinds of research that shows that when we are invalidated, our heart rate goes up, our blood pressure goes up, and then we can't actually take in new information. We certainly can't change our behavior. So if you're having trouble at work, one of the things you can do is try to be a bit more validating to yourself so that you can be effective at work. And that might sound like saying to yourself things like, well, it makes sense that I feel so overwhelmed trying to balance homeschooling my kids and managing work. It makes sense that I'm overwhelmed. It's normal to feel anxious given so much uncertainty. My thoughts are valid. What I need is valid. Or many people are feeling more agitated these days with so many restrictions and changes. But what I find is that people don't talk to themselves this way. We berate ourselves. And validation to me is a superpower. So I ask you, I invite you to try to actually validate yourself a bit more. And even, can you validate other people? Everyone's sort of doing the best they can given their biology and their learning histories. So it doesn't mean that you have to agree with somebody, but it can go a long way in your relationships at work to be able to say, like, I get that you're stressed too. This is a hard time. And I need to talk about some accommodations for what I need. It's also important to have some things like at work and that you can rely on. So I'm just looking at the chat for a minute. Can you expand on what validation and invalidation is, or an example of it? Oh, I answered the question. Awesome, Melissa, thank you. The other thing that I'll say is that I know we don't have a lot of time to go through everything in the way that I'd love to. If you have questions, you can email me. I'm happy to try to provide more resources or where you can get more of this information. And so you know what I'm going to do right here? I'm going to type in my email at midlanddbt.com. So if you want to email me, by all means, you can do that. Okay. So I love this little cartoon, right? So this is like me half the time. I'm like the zebra that there's like no coloring happening. And then, you got the therapist that comes around and like, you should color because it's supposed to relieve stress. And I'm like, okay. But what I want to highlight is that you want to have things available to you at work that can help you downregulate. Here are some tried and tested strategies. Temperature is big. If you can actually get some cold water on your face, which I understand could be hard, but a lot of us are working from home, and you can actually get your face into some cold water. If you're really distressed, a cold shower. When you do that, you activate the dive reflex or the dive response, which drops the heart rate and the blood pressure pretty fast. I have used this to stop people from engaging in self-harm behavior, emotional eating behavior. I've used this to help people fall asleep at night. It is incredibly powerful, but your head has to be involved. So it's not the same as holding ice. You've got to get the head involved for about 10 to 20 seconds. Try it. Intense exercise. So if you are feeling really dysregulated, and you're at work, again, I have my yoga mat beside me. And sometimes I just do something really intense for like a minute. And I feel it makes me feel better. So again, if you're somebody that overuses exercise, it's part of an eating disorder behavior, this isn't the skill for you. However, intense exercise changes your body chemistry. So does paired muscle relaxation and paced breathing. Okay, so these are things that you can look into and Google. There are apps, there are all kinds of things that you can download to help you start to create your own distress tolerance box or package. And probably one of the most powerful things that we can do to help us is something called radical acceptance. Radical acceptance is accepting completely and fully whatever your current circumstances are, or the people, or whatever's going on. It's the opposite of fighting reality. Do you ever fight reality? Do you ever say, this is unfair? This shouldn't happen. Why me? That's fighting reality. And the hard part about when we do that is that we take pain and we elevate it to suffering. Pain in life is inevitable. Triggers in life are inevitable. And none of us knows exactly what's coming down in terms of COVID and more restrictions. But what I ask people to do, so when we take life pain and we don't accept it, you've now elevated pain to suffering. So radical acceptance is saying, this is what happens. And it doesn't mean that you agree. It doesn't mean that you're helpless or powerless or you're giving up. And it is not about forgiveness. My experience has been that radical acceptance is probably one of the most empowering positions I can inhabit. Because the irony is, when you radically accept what's going on, you can actually get out of it. When you fight reality, you go down that rabbit hole and you get caught in that cycle. Radical acceptance might mean your personal limits or restrictions. You know, for me, for example, I've had to radically accept that I can't do as much work right now as I want to, because I'm homeschooling my daughter. And that's what I want to do. And it's really hard. And I have to accept that that's where I am right now. Radically accepting changes to your work life. Radically accepting that you can't spend Thanksgiving this year, maybe the way you'd love to. Radically accepting that you have to wear masks in most situations, that you have to socially distance, right? Now, again, it doesn't mean you like these things. It means that you're saying it is as it is. So how do I work with it? Oh, that was a slide from before that we did not need. And then I'm somebody that likes to find quotes that make me feel engaged or that help me. So, and I put them around places. So I like this one, right? It's not the strongest of the species that survives, but the most adaptable. And COVID asks us in our workplaces and in our personal lives, are we up for being flexible? And I think it's scary because when we are threatened and when we feel uncertain, we don't get more flexible. We get more rigid. We pull in. And what I'm asking employers to do, and what I'm asking everybody to do, is start to have conversations about how we can do this differently, how we can work on mental health differently in the workplace, and start to actually create work environments that support these things. If any of what I've said today rings true for you or triggered something, I think most importantly, reach out, right? Reach out, talk to somebody. There's a lot that can be done. There's a lot that people can help with. And what I want you to do is, like I said, you can email me. I know we've only got a couple of minutes left. You can email me if you have questions or want more material. You can follow the things that we post on social media, right? And let me just check if there are any questions before we wrap up for today. Oh my gosh, there's quite a bit here, so hold on. I cannot focus at work, and the more unfocused I am, the more stress I feel. It seems like a cyclical problem that keeps growing. What can I do to get off this track? Without knowing somebody, I can't, like, again, I'd have to assess things, right? You have to know if somebody has, problems with attention and all these sorts of things. But what I can tell you from today's presentation is make sure that the foundational things are there. If you're not eating properly or sleeping well enough, or there's any sort of, alcohol, drug use, etc., those things are going to interfere with your attention. So I ask people at first, like, let's do the basics. Let's try to get some of that stuff on track. Mindfulness is about learning how to strengthen the attention muscle. So it would be really interesting to see what would happen to that person if she or he did 6 weeks of mindfulness training or 4 weeks or whatever. It really does help. You also have to be aware that if there's depression or an anxiety disorder on board or an eating disorder, you might need some evidence-based treatment for that in order to help with what's going on. So those are just some things to think about. And there's another question. I will do, okay. I enjoy some parts of working from home, but there seem to be no breaks in the day now. Yeah. I try to schedule some time in between meetings, but it just seems like one Zoom call just slides into the next. It's burning me out. Is this a broader problem, or is this something I am doing? This is happening everywhere. The boundaries around our time have shifted. You do have to work diligently to really set limits. That's not easy. But what I do is I literally say, this is when I'm available, and you have to stick to it. You have to really sort of put some parameters around when you're available and when you're not. I also get people to schedule like 15 minutes between calls, if you can. And what I want you to do in that 15 minutes, there's no social media, there's nothing. Get outside, get into a downward dog, I don't know, but it is a deliberate practice. Because you're right, if you don't, it will run away with you. The last question I will read is, what do you feel would be an ideal approach for workplaces looking to support their employees during the pandemic and into the future? Have conversations with your staff regularly and let them know that you support mental health. Most employees still feel stigmatized or like they will be punished or negatively evaluated if they approach somebody about feeling stressed out. Look for workplace initiatives like doing mindfulness. Like I go into, for example, I go in and do some work with the fire departments, and I teach distress tolerance skills. And we meet for once a week for 6 weeks, and people love that kind of stuff. Look for movement things that you can do. Like, so how do you start your meetings with a mindfulness exercise? Embed these principles into the workday so that it's actually expected of your staff to engage in these things, right? And again, and I'm aware of time. This is recorded. I'm sure it will be made available at a later date. I'm not sure when and how that works. And I don't know if Holly's there to answer that in this moment. Maybe, yes, she is.
Yeah, so all of the sessions that we've been doing this week, we're going to be putting on the Waypoint YouTube channel, and then we will also share them on social media. We had quite a number of people say, I can't come in the day. I'd really like to see the session. So a lot of people sent in questions that they wanted answered, and we've let them know it will be available. We're hoping to get them up as soon as possible. It will likely be next week.
Awesome. Awesome. Thank you so much, everybody. I know it's like a lot of information in a short period of time. Again, it's my pleasure to get to talk with you today and to see some faces and people that I connect with on social media. Thank you for being here. And again, stay in touch. We're going to get through this by staying connected, not by staying apart. Okay.
Anita, thank you so much. This was such a great session, and I think this has been one of our most active chats. So it's been really nice to see the engagement and a really great series of tips and advice I think that people are really going to take away from this. So I'm glad that we are recording it, because I think there will be a lot of people who need to hear these messages. So thank you so much. And again, I want to thank LeClaire Cremation Center for sponsoring today's event, as well as Midland Honda and Brissett Concrete and Forming, who have sponsored this entire week of sessions. So thank you very much. And everybody who's donated to the COVID-19 Mental Health Relief Fund.